Hi, I'm Yuri Nikolski, and in today's short course, we're going to learn the foundations of the HL7 standard. Hi, and welcome to this mini course on HL7. By the end of this course, you'll know what HL7 is and why it exists. You'll learn what are the main types of messages that are significant in the environment of medical imaging. And you're also going to understand how does HL7 fit into modern healthcare workflow and how HL7 and DICOM work together. Let's get into it. So first of all, let's define what this actually is. In HL7, just like DICOM, is a standard. What does that mean? Well, standard is a standardized way for devices to exchange information. So you can think of it kind of like a language for medical devices. Now, HL7 serves a certain purpose and it carries certain information within its messages. Now, the type of information that we can find there is or another way associated with the patients themselves or the care that they receive. So things like patient information, orders, results, those are all primary domains of the HL7 standard. Now, if we look at imaging specifically, yes, there are some specific aspects that are more important to us than maybe to the rest of the healthcare. But actually, very important to note here that HL7 is not specific to imaging. It actually covers a very large base, and just about every avenue of healthcare uses HL7. But for us in imaging, it's actually absolutely critical for the workflow. Without HL7, we wouldn't know that there's an order. We wouldn't know if patient information has been updated. Nor would we be able to send back the report. So as you can see, the significance of HL7 should not be overstated. HL7 operates in a model where it sends out messages. Now, there's different types of messages, but these three that you see on screen are most important to us in imaging. ADT, ORM, and ORU. Now, ADT stands for Admit, Discharge, Transfer. It's an administrative type message, and it allows different systems to get information about various patients. Things like demographics, things like updates with respect to patients, things like requests for admission, transfer, discharge, everything that ultimately is governed by the scope of this message. So admit, discharge, and transfer, once again, very, very important. The next one is called ORM. Now, this is an order message. This is a message that actually carries imaging orders from the HIS to the RIS and then gets passed on to the actual devices via what we call modality work list. Now, the ORM messages actually allow us to get a lot of things conveyed, things like the orders themselves, as well as different updates to the orders, whether it's an amendment to the order or whether this is a change in order status. All of that gets conveyed via the ORM message. And again, I'll repeat myself that this type of message is absolutely critical for any type of imaging workflow. Again, important to note that the ORM message is not exclusive to imaging only. It can convey other orders, such as orders for maybe functional imaging, sometimes for the lab, even though there's some differences there. But for us in imaging, absolutely vital. And then lastly, the ORU. This is the observation result. This is how we convey, well, the results. Now, in imaging, the results are radiologist reports. But again, we should make no mistake that the ORU has a very broad scope of application in general healthcare. So for example, when you have a patient that walks into the emergency department and then they're seen by the nurse in triage, usually what the nurse would do is she or he would take the vitals of the patient, and then those vitals would be transmitted to the medical record of that patient. Well, the way that this would be done is by transmission of an ORU message, which can convey things like pulse oximetry, for example, or blood pressure, things of that nature. And that in turn, of course, would be conveyed to the patient record within the scope of the EMR. Now, let's take a look at the actual workflow that we can commonly encounter within the domain of healthcare. So let's walk through the entire thing end to end. It all starts with the order, right? The doctor has to order some kind of imaging so that we can actually perform it. Upon making the order, the ORM message, the order message, as we already discussed, fires automatically and it moves from the HIS to the RIS, the Radiology Information System, which is the terminal spot where the order information would be conveyed. Now, the next step would be for the scanner to actually retrieve the order. Now, this is done using DICOM modality worklist. So at this point, we're already using a different type of machine language, DICOM. This is very interesting because ultimately we recognize that the information itself was actually conveyed by HL7, but then retrieved using DICOM. That means that we had to convert HL7 into DICOM, and that is the essence of the DICOM modality worklist provider. Now, this capacity, this ability to pull modality worklists is absolutely instrumental. Without it, we'd have to enter all the information manually. We'd probably make a million mistakes, and we'd probably spend the whole day entering patient information, then fixing our errors. So the ability to simply select the patient from the list of all the orders for that specific modality for today, select the patient, and everything populates automatically. Naturally, this is a huge improvement within the scope of workflow. Well, all right, so we picked the patient. The next thing is to actually acquire the images. Well, not much to say about that. That's fairly standard. After that, we send the images to PACS. Now, this part is governed completely by DICOM, a different standard that covers the entirety of domains that have to do with medical images. At this point, PACS now has the study, and the next component of our workflow, the next step, if you will, of our workflow, is to have the radiologist actually read the study. So what the radiologist is going to do is they're going to open the study on PACS. They're going to start the reading component, whether you call it a reading task, whatever the actual term is, but they're all going to initiate the read. At that point, the study is going to open in the viewer in their dictation software, which usually is an integrated third-party software, is also going to open simultaneously, allowing the radiologist to dictate their findings into the speech recognition system. And then lastly, after we're done with this, HL7 comes back into our equation. And what happens is that the message known as ORU, the one that delivers the results, will actually carry the report over to the ordering physician, which is actually the whole point of doing this. We did the imaging so that the ordering physician can have the report so that they can figure out what to do with the patient. So ultimately, the big takeaway is HL7 and DICOM are not the same thing, and they're not competing. They do completely different jobs. HL7 handles the clinical coordination. It tells the systems who the patient is, what needs to happen, and what was found. Whereas DICOM, well, DICOM handles the imaging workflow. It's how the modality knows what to scan, how the images are created, how are they sent to PACS, and ultimately opened and even displayed for reading. In the workflow you just saw, HL7 was used twice, at the very beginning and at the very end, to convey the order message and to convey the result. DICOM was used in the middle in order to move the images and do everything that's associated with the domain of imaging. The conclusion here is simple. They're both required and they're tightly coupled together.